Welcome to Common Sense. The Common Sense program is a series of shows that feature interviews with very interesting people so that we can learn in a clear, concise, and direct way who these folks are, what they do, and what makes sense to them and what doesn't. I'm Rudy Breglia, and today I'll be interviewing the wise, knowledgeable, and experienced dentist and entrepreneur, Dr. Chris Constantinou.
You got it.
Okay.
Thank you very much.
All right. Well, welcome to Common Sense, Chris. And
thank you for having me.
Why don't you start us off by telling us where you were born and where have you lived?
Sure.
What brings you to this part of Ohio?
Sure. Well, I was born in Wisconsin, but my family shortly after moved to Massachusetts, where my parents were immigrants from Cyprus, and as they made their educational and employment journey to the East Coast, they ended up settling in a suburb of Boston, where I grew up. But my wife grew up in Euclid, and her parents moved to Westlake shortly after she went to college. And we had an online romance that eventually led to me moving here.
Well, that's wonderful. Mm-hmm. That's just wonderful. Welcome.
Thank you.
Okay. Tell us about your volunteer activities in the Dominican Republic.
Sure. Well, it was sort of an educational program. The tuition, so to speak, was the airfare and the accommodations and the cost to bring all of our equipment down to the Dominican Republic. Mm-hmm. And I've done it twice now. It was 3-day stretch where you're basically just doing nonstop dental surgeries, implants, extractions, bone grafts, and the like. And it's no cost to the patients there.
Okay. Well, that's wonderful. Bless you for doing that. I'm sure those people really appreciate your helping them.
They do, yeah.
What is the Tough Mudder Challenge?
Well, in my younger and more adventurous days, I would do these mud runs, or you might have heard Spartan Race or Tough Mudder. It's Tough Mudder in particular is typically a 10 to 13 mile race course, which is interspersed with some military style obstacles like crawling under a barbed wire fence or jumping into cold water or crossing monkey bars, that kind of thing. These days I try to stick to the occasional 5K. That's more my speed. But in my 20s and 30s I enjoyed doing those kinds of things.
Okay, all right. When did you become fluent in Greece, and how often do you get a chance to practice it?
Sure. Well, as I mentioned earlier, my parents are immigrants, so I learned to speak at home. But growing up, I also went to Greek school, typically twice a week.
Okay.
And I learned to read and write at that point. And now our kids are also going to Greek school, but it's a little more challenging because we're so used to speaking English. So where my parents always spoke Greek and I answered in English, it's more English at home now.
I gotcha.
But we're trying, and we get the occasion to speak Greek when we visit, and we've been trying to get there, if not every year, maybe every other year.
You go back to Cyprus?
Cyprus or Greece or some combination. Yeah.
Okay. Who are the members of your dental team, and what are their specialties?
Sure. Well, I have 2 offices, one in Westlake and one in Avon. So between the 2 offices, there are about 30 employees. But generally speaking, in a dental office, you'll have dentists, hygienists who do the cleanings and do the oral diagnosis and so on, chairside assistants who are either helping the dentist or the hygienist directly, and administrative staff. But within those groups, there are some, let's say, subspecialties. Like some assistants have done extra training to become expanded function, meaning they are given extra training to focus on the art and science of placing a nice restoration or filling after the dentist has cleaned out the decay.
Okay. What is the mission of Avon Dental?
Sure. Well, early on I realized that there are no 2 people alike and there are no 2 teeth alike within the same patient. So the emphasis I wanted was to understand our patients in order to provide appropriate dentistry in an environment of care and respect. In other words, there's no 2 treatment plans that should be alike. So we really need to know where these patients are coming from, what is their history, what is contributing to their condition and their needs and their deficiencies. And we want to do that in an environment that the same way you would want to be treated, or your mother or your father or your brother to be treated. So that's our mission.
Understand.
Yeah.
Does Avon Dental offer its own dental insurance and other payment options?
Sure.
That's always a question.
Yeah, it's not quite an insurance, but we did come up with a in-house program where patients who are not insured with traditional dental insurance can get closer to the typical insurance rates. And there are some freebies in there, like exams and so on. There are also some payment options that are more corporate in nature, like Care Credit or Lending Club, which are healthcare-based credit systems that can get patients access to spreading the payments out over longer periods of time, sometimes with low interest or no interest, or over longer periods of time with some period of interest.
Okay. What is the typical equipment in each treatment room? And I think the viewers will see a photo.
Sure. Well, of course, everyone's familiar with the dental chair.
Okay.
So there's the chair itself.
Very comfortable.
Well, I thank you. We use ADEC equipment, which is a U.S.-based company, and they make all their equipment here, and they are known for their quality and their comfort. So I'm glad you enjoy it. The chair will have something called a delivery unit, which will supply the dentist or whoever's working to the side of the patient with a handpiece that is either electric or air-driven, and a suction unit, and somewhere to provide water and air. So there's a delivery unit. Behind the chair, there's typically a similar setup for the assistant to use the suction and provide water and air. There's typically an overhead light, which gives a little bit more illumination and better visibility for what we're doing. Most of my chairs will either have we'll typically have a monitor behind the patient that we can do our work on, but I'm a big fan of having either a monitor or a TV screen in front of the patient as well, because patient education is really important.
Understand.
So being able to put up pictures or x-rays and walk the patient through what we're doing. So we're not doing something to you, we're doing it with you. It's a collaboration.
I think if people are informed, it's better.
Yeah, for sure.
How often should people visit a dentist?
The vast majority of us coming every 6 months to get your teeth cleaned, that will do the job. Some people need a little bit more attention. Again, there's no one treatment for every patient. So some patients need a little more TLC, and some of us have a great fortunate combination of genetics and habits and diet and history that they could probably go longer, but the average time it takes for plaque to harden up in the mouth and start causing problems is about 6 months.
Okay. What's the best dental hygiene practices to avoid problems?
Sure. I'm a big fan of electric toothbrushes, in particular a Sonicare or a spin brush, Oral-B spin brush. If you're using those properly with the right technique, research has shown that's better than a manual brush. Of course, flossing. It's another thing to do, but I have a dental school instructor who would say, only floss the teeth that you want to keep. So flossing is really important because the toothbrush bristles can't get in between the really tight spaces where the teeth touch each other and then below the gum line. So floss helps with that. I'm also a big fan of water pick. So anyone who's had braces or implants or bridges has probably been advised to get a water pick. That helps flush out debris and bacteria and food buildup in between the teeth. And then, of course, seeing your dentist regularly. Prevention is a lot cheaper and easier and less painful than a cure.
Yeah, so. a lot more fun.
Yes.
What are the most common dental problems?
Well, dental cavities or caries is one of the most prevalent diseases in the world. So there are very few of us who have a mouth with 0 cavities. The mouth is inherently an area with a lot of bacteria. So obviously everyone has some struggle or some difficulty with dental cavities, which over time can lead to other problems. Cavities that are unchecked can lead to tooth loss, and tooth loss can lead to worse difficulty chewing and enjoying the foods that you want to enjoy. And of course that can lead to infections. Infections can cause pain, swelling, discomfort. And then, of course, in our society today, we have a strong emphasis on cosmetics. So we all want to smile big and feel confident when we smile. And we also, many of us like tea and coffee and wine and so on, staining foods. So there's a little bit of a battle there. So
okay.
We can sort of sort it into structure or function and biology and cosmetics. So is it something that's actually hurting? Is it something that's preventing your ability to chew and eat? Something that's preventing your ability to enjoy your foods, and is it something you don't like to look at?
Okay. What illnesses may have an impact on a patient's dental health?
Yeah, well, we say the mouth is the gateway to the body. or oral health is the gateway to your body health. It is part of your body. As much as dental insurance and medical insurance don't want to agree about that, it is part of the body, and it's connected to your bloodstream, and it's affected by the chemical messages and hormones that your body is affected by. So if we had to narrow it down, let's say diabetes is a common issue or a common disease that can drastically affect the health of your teeth and your gums.
Okay.
But really, any systemic disease can have an effect on your oral health, and oftentimes the medications or treatments that we are given to deal with systemic diseases affect our oral health as well. So if we're thinking about medications that dry out your mouth or cancer treatments, that kind of thing.
Okay.
So it's important to have a connection between, your medical doctor and your dentist, and an understanding everyone is on the same page about what is being done and what needs to be done.
Okay. Why do cavities form?
Cavities are actually a byproduct of the bacteria breaking down the food that's in our mouths. So whatever we eat, the bacteria eat, and they form an acid, and acid is the enemy of our tooth enamel. So over time, that can weaken the enamel, which is the outer shield or shell of the tooth, and the further that destruction of the enamel or the inner layer of the tooth, the dentin, occurs, the more bacteria can harbor in there, and the more bacteria there are, the more acid breakdown there is, and so on.
Okay. Tell us about the Solea dental laser treatment and how does it work? And I think there's going to be a photo of that laser equipment.
Right. Well, there's always a drive towards improving how we treat our patients and how we remove this decay, how do we deal with the soft tissues. Solea is a brand. It's a particular laser that is chairside, and it has the advantage of being able to work on hard and soft tissue. So you can change the settings on the fly right on the screen, and change the diameter of the beam or the intensity of the beam, and it can almost as easily cut gum, for instance, as it can cut tooth or bone. So it may sound gruesome, but it's very precise and very clean, and it kind of disinfects as it goes. So we can do even small fillings with the laser, and the nature of the laser sometimes allows us to do it without an injection. And it's phenomenal for soft tissue procedures. So think maybe like a tongue tie, that can be done very quickly and easily. Or if there's a cavity that's far below the gum, that helps us kind of disinfect and push the gum back a little bit so that we can restore it properly.
Okay. It's wonderful new equipment.
It's great, and the hope is that that's continuing to evolve, and maybe one day we can do all of our procedures without a drill, so it'll be quieter, less painful, and cleaner and more efficient.
Okay, I'm sure people like to hear that.
Yes.
Why are silver fillings or amalgam fillings being replaced by composite resins?
Sure. Well, amalgam fillings have been in an evolution process since for hundreds of years now, and they've sort of peaked for their performance. But by their nature, it's a metal that's combined into a soft filling that can be placed into the tooth, and then it hardens. But we're relying on the tooth to mechanically retain that filling. So there are some limitations of how the tooth needs to be prepared, and it has a minimum depth to make it strong enough to withstand your chewing, and it's not the right color. So the emphasis is always in dentistry towards things that mimic our natural biology, how they look, how they feel, how they respond to different temperatures. So composite resins can be chemically bonded to the tooth. So in that sense, they are stronger. They're not, the material itself, pound for pound, is not stronger than metal, but we can make them shallower, and we can make them bond to the tooth in ways that the metal fillings can't.
Right, they become part of the tooth.
Correct, yeah.
Can poor dental health, and you've kind of answered this already, lead to serious medical problems?
Yeah, so there are a number of studies that are mostly correlative, but it makes sense if you think about it. Really unchecked gum disease, for instance, has been linked to heart disease. The inflammation that's in your mouth can lead to inflammation anywhere in your body. There's also been studies that have strongly linked it towards low birth weight babies. Again, there's the diabetes connection that kind of goes both ways. But for sure, if your mouth is not in good shape, then it could be an indication that there are problems for the rest of your body.
Okay, that's a big concern.
Yeah.
Uh, Tell us about dental implants and when should they take place?
So for a patient that is missing a single tooth, for instance, a titanium implant, what we call the implant itself is the root, essentially. It's the artificial root that we're placing into the jawbone, and a tooth can be placed on top of it. And as that technology has improved, the quality of the materials and how well it integrates with our natural bone, and then the connections that go on top of it, we've gotten more creative. Sometimes if you're missing all of your teeth, you can have a number of implants that support a denture that looks and functions just like your natural teeth. So that technology is getting better every day, and the use of implants and how they're implemented in healthcare is evolving as well. But the short answer is it's an artificial root that can support a tooth.
Okay. Lifelong.
That's the goal, yes.
Okay. Now, what is CEREC? It's the chairside economical restoration of aesthetic ceramics. Can you tell us about that? And I think the viewers will see a photo of it.
Yes. So CEREC, again, it's a brand, but kind of like how we universally say Kleenex for a tissue.
Okay.
But it is the general concept of using imaging inside the mouth to capture a 3D representation of how everything looks in the mouth, and it's very, very accurate. Using that 3D model, we can design what a restoration should look like on top of a broken tooth or a prepared tooth, and it can be linked to a machine that will mill a restoration out of a block of ceramic.
Wow.
So within about an hour or so, depending on the material, you could go from having a tooth that is prepared for a crown to having the crown in place.
Wow. In the past, this was a long process. I thought it would take a week or more to get these new structures.
Mm-hmm. Yeah, in the past, you would have to take a physical impression. So for many of us, we may recognize or remember the goopy material in a tray that you bite into, and sometimes it would have to be redone if it wasn't done just quite right. And then that would have to get sent to a lab where it would be poured up in a plaster model, and on the plaster model, the crown would be made. And the classic crowns were a porcelain fused to metal. So the metal base was made by a lost wax technique, similar to how jewelry is made. And once that base is made, then the porcelain can be layered on top. So there's a lot of labor, a lot of steps, a lot of areas along the way where things can go wrong. And it's still a viable method or technique for making crowns. But in more and more scenarios now, we can kind of skip all of those steps, do a digital scan inside the mouth, and then in the office make the crown and then have it delivered within an hour.
Wonderful. How do sealants and fluoride treatments help a patient's oral health?
Well, I mentioned earlier, prevention is better than the cure. So those things that you mentioned are both preventative measures. So sealants are meant to fill in the deep grooves on the teeth. So think of on a street where you have a crack in the road and they put a cover over it, something similar to that. So if you have deep grooves that are narrower than the bristles of your toothbrush, then it's an area that could harbor bacteria that is very, very difficult to clean, and those almost inevitably become cavities. But if they are done correctly, you can seal over those deep grooves, then they may never turn into cavities.
Protects the tooth.
Correct. And there, with fluoride, it's a hot topic these days, or it seem to be a hot topic, but the research is pretty clear that there are numerous benefits to fluoride. It strengthens the enamel and makes it more resistant to the acid breakdown that we were talking about. And it was discovered because it occurs naturally in many regions of the world, and that's how it was discovered, how the benefit was discovered. So there is definitely a place for it.
So people in that area didn't get cavities.
Yeah. It was, I can't remember the term, but it was over 100 years ago. They called it was in Colorado, and I'm blanking on the term, but these people had a lot of fluoride in the water naturally occurring in that mountainous region, and they had some fluorosis, which is a little bit of modeling, which can happen when there's too much fluoride, but they had very low incidence of cavities.
Okay. Why do you take an x-ray of your whole mouth at one time?
Yeah. Well, we're probably all familiar with those uncomfortable squares you have to put in the mouth to bite on. And that gives us a really sharp image of the areas in between the teeth. but it's a very small area. So in the move to be more whole body and prevention and so on, these around the head images, or now they're often 3D images like we have in our office, we can periodically look at all the surrounding structures. So the bone supporting the teeth, the sinuses, all the nerves, and oftentimes we can catch things like cysts or growths, sometimes cancerous growths, sinus problems, infections that we may not see on the routine images inside the mouth.
Right, and I think we're showing a photo of that.
Yeah, and the technology has become, I mean, it's pretty cool. I have to say it, being able to see different cross sections of the tooth, it's a technology that dentists 50 years ago would be astounded. And once you get used to using it and for your diagnosing and treating, it's hard to imagine ever going back.
So how often is this normally done in your office?
So for routine patients or routine visits where there are no symptoms, we typically do it every 3 to 5 years.
Okay.
Yeah.
Can you define some of the terms that are used in dentistry, like crowns and bridges and inlays, that kind of thing?
Yeah. Well, again, we mentioned before there's sort of an evolution towards trying to make these restorations mimic what biology has given us. So they have to be strong and durable, basically function under extreme stress, underwater if you think about it, for years and years and years.
Right.
And we can generate up to hundreds of pounds per square inch with our jaws in a healthy human. So the materials have changed, and the terms that we use are sometimes a little fluid. So a crown, for instance, if we want to simplify it, think of it as a helmet that goes over your head. If the nut tooth structure has been lost, then we can kind of deliberately remove the remaining enamel, and our goal is to replace that remaining enamel with one solid piece of ceramic. So that would be a ceramic crown. A bridge is if you're missing a space and you're not a candidate or unable to get an implant, then you can use 2 adjacent teeth, basically putting crowns on those adjacent teeth with a false tooth in between. Veneers, I always often use the analogy of a press-on nail. So if you think about a thin piece of ceramic,
okay,
like a floor tile you could probably break over your knee. It's that delicate, but when you cement it onto a floor that is a good foundation and not moving, that may last 100 years under pressure. So veneers go on the face of the tooth for cosmetic purposes. So those are just a couple of different examples of the terms. But as the materials have shifted and changed, the definition of what they are becomes a little fluid.
Understand. Mm-hmm. Why do people grind their teeth and clench their jaws? And I think this takes place even while you're sleeping.
Yeah, oftentimes patients aren't conscious of the stresses that they're taking out while they're sleeping. And I think that is probably the main issue is stress.
Okay.
We can clench and grind consciously or unconsciously if we're worked up about something.
So it's a psychological.
It can be, yeah, in many instances. There are other instances like trauma. So if you've been in an accident, for instance, and you have an imbalance in the joints, that can lead to some imbalanced chewing and grinding. There can be a skeletal mismatch, between your upper and lower jaw where the teeth aren't lined up correctly, and that can lead to some uneven wear. But yeah, for some people who have extreme grinding, we usually try to protect the teeth and the joints with a night guard or holistic measures like trying to reduce stress, yoga, meditation, prayer. And sometimes we even do Botox into the muscles to relax the muscles so they're not clenching quite so bad.
Okay. What are mouth guards and when are they needed?
Right, so in instances where we are trying to get to the ultimate why the patient is grinding, in the meantime we try to protect the teeth. And there are different kinds of night guards, so I believe we have a picture up there. But the main goal, or the overarching goal, is to create protection between the teeth so that you're not clenching and grinding and ruining the enamel quite so much. And that bit of separation between the upper and lower jaws also creates a little bit of relaxation in the joints so that there is not a bone-on-bone impact, and it gives everything a chance to kind of rest and heal. Within that realm, though, there are a dozen different varieties of ways you can design the night guard, and if it's an upper or is it a lower, depending on the exact situation for the patient, but that's the general sense.
Okay. What is TMJ and how is it treated? And I think it relates to what we just talked about.
It is related, yeah. TMJ is the short for temporal mandibular joint, which is the fancy way of saying your jaw joint. So we have two TMJs. Often patients will say, I have TMJ, which what they mean is I have temporal mandibular dysfunction, or TMD. So there's some imbalance either in the joints or the muscles or the teeth, or they're just stress in their grinding, which is causing, think of running on pavement versus running on grass. It would hurt your knee, and the TMJ is a joint just like a knee or a hip or an elbow.
Okay.
Yeah.
What oral cancer screening do you normally conduct, and what are you looking for in the mouth?
Yeah, so the inside the mouth, we're doing a very thorough visual exam. We're also kind of feeling around the area. We're looking for asymmetries, lumps and bumps, things that shouldn't be there. If you have a scrape or a burn in your mouth, that should resolve on its own within a week or two. If you have something in your mouth that looks unusual, that has taken more than a week or two to resolve, then that may be worth getting a biopsy. Sometimes we do physical manipulation to check the lymph nodes and the glands, the thyroid. Again, if there are asymmetries or lumps or bumps, then it's something we're looking for.
Okay. What procedures do you employ to assure the facility is germ-free and your patients are protected?
Sure. Well, we follow all the standard guidelines of disinfection. We use sterilizers. It's steam under pressure or heat under pressure to disinfect. So usually the instruments will go through a kind of assembly line of a scrub and then an ultrasonic bath to break up any particles and debris. And they're rinsed and put in a sterilization bag and then in the sterilizer. Every week we have to send in, it's a tab with some spores and bacteria and so on that we put into one of the sterilizer bags and run in the sterilizer, and then we send it in, and that should be completely wiped out of any living organisms.
Working,
yeah. So it's a spore test, let's say. So we follow all the guidelines to make sure everyone's getting a good experience.
Okay. In summary, what makes sense to you and what doesn't?
Well, it's interesting that in healthcare we call it practice, and it really is that, because you're learning every day. Part of our mission statement has come from the idea that there are no two people alike. So you're learning every day. You're meeting new people. You're learning their stories. You're hearing about them. It's important to maintain curiosity. I mentioned in a couple different ways that there's an evolution of our materials, of our techniques. I think like most things in healthcare, it's advancing very quickly, and it's important to be aware of it, know where we are in those processes. Are we at the experimental stage of a material? Is this worth bringing into the practice, or is this tried and true, or is it something that's been around for 50, 60 years? So within that context, it's important to stay on top of the research and see what's happening. And that's for me where the practice part comes in, and what keeps it fun and interesting is that it's never the same. Every day is a little bit different, and every year seems to be different too.
Okay.
Yeah.
Well, where are your offices located if people wanted to go?
Yeah, so in Avon, we're on Colorado Ave. We're just down the street from the new library that was built there, the public library. And in Westlake, we're on Center Ridge in Columbia. So we're a few minutes from 480 in one direction and a few minutes from 90 in the other direction.
Okay. How can someone get in touch with you in your office?
Well, we have some really friendly staff that will answer the phone.
Okay.
So we can put up the phone number there. And our website has some information, some outlines of what we discussed today, and some pictures and some images of our staff. Those are probably the best ways, is looking at our website or giving a call and come on in. And I'm always happy to do a quick informational discussion, a sit down where we're not committed to anything. So if you want to come meet me or any of the staff, or any of the other doctors, we can make that happen.
Okay. What's the website address?
So for Avon, it's avondental.ohio.com, and for Westlake, it's westlakedental.associates.com.
Okay. Well, it's been just great talking with you. You're obviously a really great person.
Oh, thank you.
With your volunteer activities and your knowledge of dentistry and oral health and passing these tips on to people. Thank you very much for doing that.
It's been a pleasure. Thank you.
I hope things work out for you and that you stay in this area and provide services to the people of our community.
Yes. Well, I'm still here temporarily while my wife finishes her training. That's kind of the inside joke. I came here just temporarily,
Exactly.
but once we developed, grew some roots, we have a home, we had our kids. So this is home now, and as much as I fought it at first, Cleveland is a great area to be. It's a great area to live and raise family, and I'm happy to be here.
Okay. Well, thank you for watching. Please let us know if you have any comments or questions. If you'd like to appear on this show, or you know someone who's interesting who would like to appear, please let us know and give us their contact information. And remember, seatbelts save lives.